Okay, here's an interesting question. How do you know when you're optimized? Now, health is a multifaceted concept. So you've obviously got the nutritional side of things, exercise, lifestyle, you've got your genetics, you've got your environment, you've got social aspects that sort of all contribute to your sense of well-being. So how do you know when you are healthy from a male androgen perspective? Now, we always talk about the importance of looking at qualitative symptoms over quantitative markers. Now, obviously, the premise behind testosterone replacement therapy is to optimize your male androgen levels to keep them within normal physiological parameters so that you can feel the health benefits of optimal testosterone, optimal free testosterone, optimal DHT, optimal estrogen, and have them all in balance. So how do you know when you're optimized? Well, having said all that, with the fact that nutrition plays a part, lifestyle plays a part, how do you actually know? Guys tend to notice an increase in energy, a feeling of well-being, an increase in libido, resolution of erectile dysfunction. They do notice it, but they only really notice it properly when they address all the other aspects of their health. So being optimized isn't simply having optimized male androgen levels. It's recognizing the importance of all of the other aspects of health so that you can make the most of having your optimal male androgen levels and fulfilling your biological function. So it's a difficult one because you know, I have parameters that I like to work from. They're not rigid, not set in stone, but you can't escape the fact that we are human beings and we're not supposed to have elevated levels or disproportionate levels of the different androgens. You know, everything needs to be in balance. Balance is a bit of a dirty word, but yeah, you know what I mean. It's supposed to be in balance. So, what's my favourite sign? Well, my favourite sign of being optimized is morning glory, because it's primarily under androgen control. Now, what is the purpose of a morning erection? It's a bit of a misnomer, isn't it? It's not really a morning erection because it actually happens multiple times throughout the night. So essentially what it is, it's the release of nitric oxide within the penis so that your penis engorges and you have an erection. Well, what's the point of that? You're asleep. Well, I'll tell you the point. The point in having a morning erection is so that when you want to use your penis in anger, it will grow to a full size. So, you know, as we've already discussed, optimal male androgen levels will make you strong because you need to be able to attract a mate. You need to be strong enough to look after your child once that's born. And it should allow you to procreate, which means obviously to attain an erection and shoot your little fellas out. So that's what it's about. So a morning erection essentially prepares you. It allows you to have confidence in attaining a full erection when you need to. So, okay, should I say this? Yeah, it's a bit of a weird one. Okay, listen, as I said, I've seen way too many male penises in my time, and at work, I might add, at work. So I will make comment on this. So old fellas tend to have smaller penises than younger fellas, and the reason why that is because they don't have morning erections, because they don't have optimal male androgen levels. and so subsequently the spongy tissue within the penis gets a bit more fibrotic and it can't dilate to full size. So there is some evidence to suggest that having HCG will engorge one's penis, and it can increase penis size if you have a micro penis. Now, not many people want to admit to having a micro penis, but there are always degrees. There's always a scale. So you may notice when you have low testosterone that your penis isn't as large as when you were younger. And you put that down to, oh, I don't feel very good, and da-da-da. But there's an element of the fact that actually it's suboptimal male androgen levels. It's not in your imagination. It's actually the fact that, you're not going to be using it to full capacity, because with low testosterone, you tend to not have regular morning erections. And people do describe an improvement in their fullness. Obviously the length is slightly limited by the fact there's a ligament, but people do notice that they do have an increase in fullness of their penis when they are optimized on testosterone and HCG. So how do you know you're optimized? Morning glory.